Here is a routine case of phacoemulsification of nuclear cataract and pseudoexfoliation in a sunken eye as it's clear. I started with 2.4 temporal clear corneal incision next to the limbal vessels. Then while I filled the anterior chamber with dispersive OVD, look what's happened. Flying cannula. The cannula detached under pressure during injections OVD or fluid into the anterior chamber or during corneal incisions stromal hydration. The innocent cannula can become a dangerous missile capable of severe intraocular damage and complications. As you can see here in slow motion, the cannula dislodged from the syringe and hit the angle and the iris, and the bleeding has been starting. So why this happened and how can we prevent it? An awareness of this dangerous complication is the first step in its prevention. As Robert Osher stated, the main reason is loosely tightness of the cannula to the syringe, so it's important to educate the scrub assistant about the importance of securing the cannula and then test injection it before hand the syringe to the surgeon, which I always do during my routine cases. I always hold the hub of the cannula between my left hand fingers before commencing the injection of either OVD or fluid into the antechamber or incision hydration. By pinching the hub, I can prevent or minimize the damage which could inadvertently result from cannula detached during forceful injections. Embedding the cannula's tip into the lateral border of corneal incision during the hydration of incisions could protect from this complication during the hydration step. I always test the cannula before entering the antechamber for both patency and tightness to the syringe. As you can see, mild bleeding into the antechamber particularly present when the pressure in the antechamber go down. So it's important to keep the antechamber very well formed with considerable pressure by the end of the surgery, or to leave an air bubble in the antechamber to prevent more bleeding. So take a home message: securing the cannula into the syringe, testing the cannula before entering the antechamber, and holding the hub of the cannula by the second hand all together could prevent dangerous complications which can move a simple case to a disaster.